Fine. So first of all, we're going to do an initial sequence just with you sittings. This is at the beginning of the treatments. This is just to sort of introduce your hands to the patient and let them know a little bit about what we're doing. So I'm just using some Nivea cream. Just drop your head forwards a little bit. Okay, so normally when I make the initial contact, just to use nice sort of generous strokes, just to introduce your hands nicely to the patient. And then what I do is this, I usually say, to introduce the idea of a trigger point or a knot, is I'm going to put a little bit of pressure through a trigger point in your back, and this is what we're going to be doing sort of through your shoulder. So if I find the point, you'll find initially you might find it a little bit painful. Let's just see here, and we're going to just use one for the trapezius here. You feel that there? Okay, but so your initial reaction might be to sort of pull against it, but what I need you to do is to think about your breathing and just relax into it and let go. Now sometimes when we press here, you might feel that go up to the back of the ear or to the back of your neck. That's really good, and the more you can sort of let go into your breathing, the better. Wonderful. Okay, good, that was really good. And we're going to do that sort of thing all around your shoulder as we treat you. Your instinct, because some of it will be a little bit painful, is to sort of brace against it. But what I need you to do is just to relax into it and to breathe, and you'll see that the pain will melt away. Good. Good, and what we're going to do now is just, if you have a chance at the end, you may not have the time to do this, but if you can, it's good just to do a little bit of work at the end, the generalized procedure at the end, just to loosen up the neck and the shoulder and just calm things down. So again, just a straightforward effleurage massage, but this time perhaps working a little bit more into the neck. And again, this just sort of eases the patient down a little bit. It's like a kind of warm down at the end. And you might want to work a little bit into the neck. Again, the neck is bound to be a little bit stiff because the patient hasn't been moving their shoulder properly, and it just is a helpful thing to do at the end of each session, just to work a little bit on the neck as well, because inevitably as the sequence proceeds, as people get better, they're going to need a little bit of work done on the neck as well. Good. Again, another modification that you might find useful if you want to generate a little bit more force, and this helps you get into the subscapularis tendon, is to stand anterior, stand in front of the patient, drop their arm down, and to come into the step 2 trigger point this way. And this just allows you to sort of get a slightly different accent, slightly different nuance on that point. It allows you to come a little bit deeper. You feel that on there, Kathy? You need to breathe that one through and hold it and breathe it out and let it go. You might have to hold a little while here and relax. So we're coming to the end of the treatment sequence now, and the last point is really, again, one of the most important points. What we're looking for is an area in the back of the capsule. It's really in the infraspinatus where it starts to meet teres minor, is a little trigger point in the posterior capsule. Let's just lift this up a little bit here if that's okay, just to show. So we're kind of looking, it's roughly a hand's breadth where the fingers meet, if you let the shoulder drop, where the fingers meet comfortably under here. This one people find a little bit more difficult to find, so it's worth taking your time to locate it. But when you get it, you really know you've got it. So drop the shoulder down there. And what I'm doing is I'm using my fingers. Now, important that you support your elbow when you do this, because otherwise you'll get your own problems with the wrist. So we're going to ask that shoulder to drop back, if we can, into that point. And it's a rather nasty one. You know it when you've found it. And what happens is that when you get the exact right trigger point, the patient feels the pain reflected into the long head of the biceps. So they'll tell you, you just ask them, and they'll tell you exactly, whether you're in the right place or not. I don't know if you're feeling any of that at the moment. Okay, so again, it's just reflects the pain down into the long head of the biceps. We're going to hold that trigger point until we feel it soften and relax. Now it can be extremely tender at the beginning, especially in a phase 1 or a sort of early phase 2 where someone's really feeling a little bit tender. They might not want to let you put all the weight of their shoulder through it, but it's good just to gently encourage them to think about the breathing in and out and just let it come back. And if you can, maybe just pop one hand on top just to hold underneath so that you've really got that trigger point, you've really found it. And again, when that softens, we've finished the sequence. This can be quite useful in phase 1 or phase 2 when things are acute. And what we're going to do is we're going to come into the sulcus between the long head and the short head of the biceps. So the biceps runs up the arm, divides into 2, so we're really looking to come with our pressure through here. And what can happen is that you can get a pooling of inflammation right in between the 2 heads. So you want to feel as you're coming in, right, we're right on it there. You can feel the kind of V shape as the biceps splits into 2, and we're coming right into the center, we're leaning in, and I'm actually going to be taking my sort of pressure downwards here. Again, if you want to reinforce by making a triangle, just bringing it downwards towards me here and in. We're pausing there, we're taking it in little circles, just making sure we get right into the sulcus between the 2. That's good. Her tummy's going, which is a very good sign.